Are you or someone you love struggling with chronic pain? Do you think you are out of options when it comes to stopping that pain? Well, here to tell us how prolotherapy may be able to help is Dr. Ross Hauser. He's a prolotherapist at Caring Medical Center. Good morning.
Yeah, thanks,
Welcome
Carol.
back.
Thanks for having me again.
So this is so interesting. Again, a lot of people talking about prolotherapy. We'll get into that, to kind of the details of it here in just a second. But this morning we're going to talk about over-manipulation syndrome, which I haven't really heard of, but it does kind of make sense. How do you explain what that is, over-manipulation?
Well, Carly, I'm sure in a restaurant or even with some friends, you've seen them crack their necks.
Oh, yeah.
You know, they crack their necks. So the problem with that is if you get manipulation, too much manipulation, or you yourself manipulate your neck or your back too much, it gets the joints in the spine unstable. And that's why you get chronic muscle spasms. So manipulating yourself, you know, your neck, or you're cracking your back or cracking your knuckles or whatever, it's going to stretch out the ligaments that are like the hinges of the joints. And when once those ligaments are stretched out, you're going to end up with chronic muscle pain and chronic pain.
Well, let's get to some videos because we have some good examples of kind of what happens. The first is kind of when the chiropractor is, this is essentially pretty common.
Yeah.
That just looks painful.
Yeah, no, and chiropractic manipulation can help people. The problem is if you get too much of it, you see on the video here, you'll see the ligament's going to get torn. See that ligament get torn? So that's the upper cervical ligament, and the problem is ligaments, when they get stretched out too much, they can stay stretched out. So somebody who needs more and more manipulation, it means that the ligament is too stretched out, so you need to get prolotherapy to tighten the ligament. That's basically what...
I mean, that's not the goal of trying to get that done, and they're not trying to do that, just unfortunately when it's...
No, we've all had, most of us have had some type of manipulation, and manipulation has a role, but if
so
somebody...
this is when you're trying to do it yourself, kind of the same thing can happen?
Yeah, exactly. That's, people do that. And anytime you manipulate yourself, you're manipulating the same segment over and over again. And you'll see again on this 3D video here, see how the ligament there, the ligaments are those gray structures that hold the vertebrae in place. And if they become overstretched, the only thing the body has left to stabilize the spine is the muscles, and the muscles go into spasm.
Does that just happen over time, kind of gradually, or is it one jerk that kind of will...
Yeah, there's several mechanisms about how ligaments get stretched. They can, if you have too forceful of a rotation of the neck, that can permanently stretch out the ligaments. But again, there's a treatment to do that, which is prolotherapy. Yeah, and this is kind of the last one where I think this may happen over time, where so many of us looking at our phones, hunched over, looking at the computers. This is our life now, doctor. Yeah, see how the person on this video, they're having some neck pain because the ligaments over time are getting stretched out. Yeah. The slow stretching of ligaments is called creep. Creep is the slow stretching of ligaments. See how the ligaments there are getting stretched. So the treatment to stimulate the repair to get the ligaments tight again is prolotherapy. Okay. All right. So talk a little bit about prolotherapy. Explain what it is, because it's a new concept that I think people are hearing for the first time here in Southwest Florida. Yeah, we opened up the first full-time prolotherapy center here in Fort Myers, and prolotherapy is a natural injection therapy where you inject the ligaments to tighten the ligaments, strengthen the ligaments, which will again have the vertebrae stay in alignment, stabilize the spine, and then the pain goes away. So it can be a permanent pain solution instead of a temporary pain solution. Like if you have a structural weakness in the neck or the back from the ligaments being stretched out because either you were manipulated too much or you were bent over texting all the time, the treatment to cause those ligaments to tighten and strengthen is prolotherapy. You know, and we kind of just showed the neck area, you know, this morning, but this is something that can kind of happen all over the body, and prolotherapy may be able to, you know, to help again in kind of all parts of the body. The weak link in the musculoskeletal system is the ligaments. Like if you have a cabinet, where's the cabinet going to break down? It's going to break down in the hinge. Yeah. Everybody knows that. And when the hinge is loose, you need to screw it in. So the treatment to screw it in or tighten the hinges in the body is prolotherapy. That's why prolotherapy often gives long-term pain relief. And it's non-surgical, which I think people really are looking for a non-surgical option. Or maybe even we've talked about before, they've had surgery and for whatever reason it didn't work. It didn't stop their pain. Yeah, which means that the pain was from another source. So often the source is, again, where the musculoskeletal system is going to break down is in the weak link, which is the ligaments. So
Well, doctor, as we wrap up here, I mean, if someone's watching and they say, I don't know more about prolotherapy, what do you suggest they do? How do they know if they're a candidate for prolotherapy?
Well, our website's great, caringmedical.com, and then also, obviously, make an appointment. Usually, if you have chronic pain, it means you can't eliminate the pain by yourself.
Okay.
But you need some help, and hopefully people will give us a chance to help.
Yeah, and again, a new clinic here in Southwest Florida, one of the first of its kind here for us. So again, I know a lot of people are going to be interested to hear what you're able to do for people. So for more on Caring Medical Center, all you have to do is head to our website, foxmorningblend.com.
Up next, a New York Times bestseller and the author of The Longest Ride. We get a front seat view to his movie coming up next.